Another question that people often ask: how can cancer be a friend or a useful disease since it kills a lot of people? We need to clarify one thing. People with cancer may die with their cancer, but they do not all die of cancer. A person with intestinal cancer gets killed in a car accident. Obviously, this person didn't die of cancer, but she died with her cancer. Or a person with a tooth cavity who dies of a heart attack. She didn't die because of her cavity, but she died with her cavity. I say that because in most people, there is a strong cultural association, a belief that cancer always leads to death. Statistically speaking, this is totally false. It's true to only 40% of people with cancer. It means that 60% of cancer people die from something totally different that has nothing to do with their cancer. Also, some people have leukemia, prostate cancer, or brain tumors without knowing it during their lifetime, which are only discovered during the post-mortem examination. So disease is not a promise of eternity, but it's an additional chance of adaptation. In cancer, the identity conflict is more pronounced. I identify to my job or my car, and I lose it. This is something vital to me, and it causes an issue, so my body creates an emergency solution which is intended by nature in the first place. Disease is a time extension for adaptation when a shock happens. For instance, if a person lacks of food, he will develop a nodule in the liver in order to store more food inside of him. Of course, if he doesn't have any food for several weeks, he will eventually die of starvation. The body carries this extra chance of adaptation as animals, which also have diseases. But in nature, things have to be solved quickly, which animals can do since they don't have the symbolization system that is specific to human beings. So cancer functions independently. It disconnects from reality, and in the unconscious, the drama continues to act and looks for inside solutions. Like this person who is scuba diving and runs out of oxygen. Same can happen with someone stuck in an elevator, or someone hiking in high altitude will produce more red blood cells. Of course, if there is no more oxygen, the person will die. So, we have this extra chance, this time extension for adaptation. And the human being must be able to change its relation with the external world, the outside circumstances, in order to heal.